Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about cardiac output and what the factors maintaining cardiac output. So introduction: cardiac output is the amount of blood pumped from each ventricle, usually left ventricle, through aorta. It is the most important factor in cardiovascular system because the rate of blood flow through different part of the body depend on cardiac output. It is expressed in three ways: stroke volume, minute volume, and cardiac index. Stroke volume is the amount of blood pumped out by each ventricle during per beat. Normal is 70 ml when heart rate is normal, that is 72 beat per minute. And minute volume is the amount of blood pumped out by each ventricle in 1 minute. And minute volume is equal to stroke volume into heart rate. And normal value is 5 liter per ventricle per minute, that is average 5 to 8 liters. Cardiac index, it is the minute, we can say, uh, expressed in relation to square meter of the body surface area and the amount of blood pumped out per ventricle per minute per square meter of the body surface area. So ejection fraction is the fraction of the end diastolic volume that is ejected out by each ventricle, and normal is 60 to 65%. Cardiac reserve, maximum amount of blood that pumped out by heart above normal value. And cardiac reserve play an important role in increasing the cardiac output during the conditions like exercise. And in young adults, that is 300 to 400%, old age 200 to 250%, athletes 500 to 600%, cardiac disease, we can say minimum of 0. So variants are age, sex, diurnal variant, ENV, emotion, and after meal, sleep, pregnancy, exercise, and high altitude. So pathologies which can increase the cardiac output like fever, anemia, hyperthyroidism, and decreases variants which decrease the cardiac output are hypothyroidism, atrial fibrillation, incomplete heart block, CCF, shock, and hemorrhage. So basically, the distribution of cardiac output to liver is 1500, 1300 ml to kidney, the 900 to and 800 to skeletal muscle and brain respectively. To skin, bone, GIT tract is 300 ml, and to heart it is 200 ml. So what are the factors maintaining the cardiac output? First is venous return, means the amount of blood which is returned to heart from different body parts. So when it increases, the ventricular filling and cardiac output increases. It is directly proportional to venous return, which is regulated by 5 factors. So first we are having the respiratory pump, muscle pump, gravity, venous pressure, sympathetic tone. So respiratory pump means the respiratory activity which helps blood back to heart during inspiration, which is abdominothoracic pump. During inspiration, the thoracic cavity expands, makes the intrathoracic pressure more negative. So it also increases the diameter, resulting increase in venous return. Also, descent of diaphragm increases intra-abdominal vein and pushes blood upward toward heart by venous return is increased. Next is muscle pump, that is muscle activity, which help in returning the blood back to the heart. So during the contraction, the veins are compressed and squeezed. So there is a valve in the vein. So during compression, the blood is more towards the heart. And also due to muscle activity, the venous return increases. Gravity, like gravitational force, reduce the venous return. So like if one stands for a long period of time, then gravity goes pooling off blood in the legs, which is called venous pooling, and due to which there is decrease in venous return. Venous pressure, like pressure on the venules, is 12 to 18 mm of Hg, which gradually decreased in small to large vein, and pressure can fall to 5.5 mm of Hg. And pressure gradient at every part of venous tree helps as a driving force of venous return. Next, we are having the sympathetic tone. So venous return is aided by sympathetic or vasomotor tone, and sympathetic tone causes the constriction of venules. Vasoconstriction pushes the blood towards the heart. Thank you.